On a global level, the demographic challenges have a major impact on the health and care services.
The Nordic cooperation in the field of healthcare relies heavily on innovation. That means that we share new ideas, new research, new technologies, new solutions, and we work together in an extensive Nordic cooperation to make this as best as possible for the patients. The patient is in the center of the development of healthcare in the Nordic countries. The patient is also at the center of his and her own healthcare. So this implies sharing of information, transparency, and the respect of the integrity of the individual.
As a consequence to the challenge of an increasing amount of people with lifestyle diseases, the Nordics focus on prevention that limits the risk of a chronic condition by using data.
The new with this kind of application is that it's searching in the background for all the patient's diagnosis, perhaps 10 years ago, and gives me all this information on one single screenshot, and even the risk of having a stroke.
In Sweden, citizens are empowered to monitor and track their health situation by following their own heart rhythm to detect for atrial fibrillation.
We have this fast lane with a stroke unit. When the patient is going home, they just come down to us. We show them how the device works. Then they go home for 21 days. And every night and every morning they send in this ECG. And we check them daily for atrial fibrillation.
Due to the geographical conditions in Iceland, as well as a wish for bringing the specialists closer to the citizen, there is a need for sharing important health information across distances.
I'm a type 1 diabetic, and I was lucky enough to be able to receive a sensor that I place on my arm. Using the app, I get all the information and accessibility to my numbers in real time.
There has been a very close Nordic collaboration, so we have developed the oximetry technology here in Iceland, and our Danish colleagues have used it to demonstrate that in diabetes and diabetic eye disease, there are changes in the oxygen metabolism of the retina that correlate extremely well with the severity of disease. So we think we have an automatic way to measure the severity of retinopathy and thereby automatically find out the need for treatment.
All over the world, more and more people are getting diagnosed with cancer, but due to the benefit of personalized treatment, people are increasingly recovering from the disease. High-quality health data based on a personal unique identification number creates the opportunity for personalized treatment of cancer. In Finland, these health data also depend on patient involvement.
Every cancer and every patient is different. That's why we need the personalized cancer treatments.
The amount of people with dementia is increasing worldwide. At the same time, the dementia disease also has an extensive impact on both relatives and caregivers. In Norway, elderly citizens with dementia and their relatives maintain a close relationship because they share information about the daily activities and conditions.
For instance, if the patient has dementia, which makes it hard for them to remember what's going on in their day-to-day life, they need to have a strong communication between the family caregivers and the health personnel.
Furthermore, images and sound effects from familiar surroundings have a positive impact on this group of patients.
One of the ways we work with our patients with dementia is using multi-view. So if we find the right film for our patients from the country, we can bring back their memories, and that will also motivate them to exercise.
Like many other countries, the Nordics have a growing number of patients with chronic conditions. Telehealth solutions may help the healthcare system to meet this challenge. In Denmark, citizens are supported to sustain their quality of life by reducing the length of stay in hospital and providing home treatment.
It's better for the citizens to be treated at home because we see that they experience increased quality of life. They feel more security. They are able to have a better dialogue with the healthcare professionals.
Because of the great benefits within telemedicine, Denmark is in the process of deploying telehealth for COPD patients on a national level by 2019.
The Nordic countries work together to position itself by addressing global health issues by developing high-quality solutions in healthcare and present those solutions to the market together.
Visit Nordic Innovation to learn more about the Nordic solutions.